Assalamualaikum. I am Dr. Tanzim Tahsin Tamanna, lecturer anatomy, Bosundhara Addin Medical College, South Keranigঞ্জ, Dhaka. Today I am discuss about the joints of the thorax. In thorax card, we briefly discuss about the sternum, vertebra and ribs. In three bones, they make different types of joint between them. Before discussing about the joints of the thorax, at first we should know what is joints. Joints means articulation between two or three bones where movement is possible or not. In two or three bones, when joint is made, then the articular surface are come in contact with each other. In human body, the joints are divided into three types structurally. First, fibrous joint, second, cartilaginous joint, and third, synovial joint. These joints make different types of movement. Now I am discuss about the joints of the thorax. In thorax card, we read about the sternum and the ribs and the vertebra. At first, the ribs and vertebra, they make different types of joint. First, I am discuss about the costovertebral joint. In case of costovertebral joint, the ribs and the body of the vertebra makes a joint, and it is a plain type of synovial joint. Second, I am discuss about the costotransverse joint. In costotransverse joint, the tubercle of the rib and transverse process of the vertebra makes a joint. This is also a plain variety of synovial joint. Next, rib makes another joint with its costal cartilage. In case of ribs and the costal cartilage, here costochondral joints is formed. Costochondral joints is a primary cartilaginous joint. In case of primary cartilaginous joint, no movement is possible. Next, we come to know about the joints of the sternum. We all know sternum has three parts: manubrium, body and the xiphoid process. In case of manubrium and the body, here present manubrio-sternal joint. It is a secondary cartilaginous joint. Most of the midline joints are secondary cartilaginous joint. Next, the joint between the body and the xiphoid process. It is known as xiphisternal joint. It is a primary cartilaginous joint. Next, we come about the joints between the vertebra. In case of vertebra, there are different types of joints are present between the vertebra. They all are known as intervertebral joint. In case of intervertebral joint, at first we discuss about the joint between the vertebral body. Joint between the vertebral body, it is a secondary cartilaginous joint. By forming this joint, another cartilage is necessary. This is known as intervertebral disc or fibrocartilage. Next joint is from between the vertebra. It is the articular process of the vertebra between the superior articular process and the inferior articular process. This joint is known as plain variety of synovial joint or zygopophyseal joint, or another name is known as facet joint. Next, we discuss about the joint between the adjacent lamina, spine and the transverse process of the vertebra. These joints is known as syndesmosis variety of fibrous joint. In this joint, different parts of the vertebra are articulate, such as adjacent lamina, spine, transverse process. And next we discuss about the joint between the costal cartilage. In case of costal cartilage, we all know that 1 to 7 ribs articulate 1 to 7 ribs are joined from in the sternum. They are known as costochondral joint. It's a primary cartilaginous joint. Costosternal joint, it's a plain variety of synovial joint in case of second to last, and first chondrosternal joint is a primary cartilaginous joint. What is chondrosternal joint? In case of chondrosternal joint, the costal cartilage are articulate with the sternum. When the costal cartilage are articulate with the sternum, in this case the first chondrosternal joint is a primary cartilaginous joint, and next are plain variety of synovial joint. And another last joint presence in the thorax, this is interchondral joint. Interchondral joints are the joints in these joints the costal cartilage are joined in between them, and it is also a synovial joint. Thank you all.